Welcome. My name is Professor Kshitij Kapoor, and this is episode 2 of Life After Coronavirus, The Expert View. Today, our topic is the end to isolation. What is it going to take? Join me as I discuss modeling and the public health imperatives, the introduction of this new tracing and tracking app and its acceptance by Australians, the role of government, and who is looking over government, with 3 of the world-leading experts located right here at the University of Melbourne. We are currently living through one of the most extraordinary scenarios of voluntary lockdown of billions of people. Nothing like this has ever been done before. But what happens once we lift these restrictions? What kind of world will we face? What does this mean for the future of health, for the future of economics, for the future of politics, and the future of society? That is what we are here to talk about. And what we're seeking are experts who know the evidence. And we are fortunate at the University of Melbourne to have a rich pool from which to choose from, so let me turn to them. And I'm pleased to be joined by Professor Jodie McVernon. She's the Director of Epidemiology at the Doherty Institute. She's a medical doctor with specialty in pediatrics and public health and vaccinology. No doubt, she has been a key advisor to the government through COVID-19. Professor Adrienne Stone is a lawyer, a Redmond Barry Distinguished Professor and Director of the Centre for Comparative Constitutional Studies. She researches constitutional law and constitutional theory. And Professor Simon Dennis is the Director of the Complex Human Data Hub in the Melbourne School of Psychological Sciences. The Hub's main aim is to understand human behavior using computational methods with big data. So turning to them, Jodie, you're a clinician and public health expert. From your perspective, end to isolation, what's it going to take?
So it's going to take time. The idea of going back to life as normal, as we knew it before this virus, is going to take some substantive medical breakthroughs that would mean that we have therapies or vaccines to prevent us catching this virus or to reduce our risk of severe outcomes and death. In the meantime, we have to learn to adapt to living with it.
So we'll come back and see how we adapt to that. But one part of that adaptation is going to be perhaps an increasing role of data. Now, Simon, you study data, you study human behavior. End to isolation, what will it mean from a data perspective?
So I think over the last little while, everybody's become amateur data scientists as they've been watching these curves. And I think that's what we're going to have to continue to do. We're going to have to monitor people's behaviour and see to what extent they're conforming to the guidelines and how that's interacting with the health response.
Now, Simon, you're a scientist. You love data, you love monitoring, but of course monitoring comes close to surveillance, and a lot of us get worried about that. So, Professor Adrienne Stone, to a lawyer and a constitutional expert, what does all of this mean to you? End to isolation, what worries you?
So as we come out of isolation and we deal with the public health crisis and the economic crisis, we're going to need government like we've never needed it before. And it's really important then that we make sure that government continues to act lawfully and fairly and with proper scrutiny.
Right. So look, you've laid out a beautiful perspective of what we will need, but let me turn to you, Jodie, first, to the data that we have on how we are doing in Australia at present. If we could just see the graphic, and this is the curve that everyone has been watching. It's the curve of how the cases are going up and down. Jodie, walk us through this. What do you see when you look at this curve?
So I think the first thing we need to appreciate is that that rise in cases really wasn't about an epidemic in Australia. It was about an epidemic in the rest of the world. The vast majority of the cases that we've seen here were imported.
Oh, right.
About a third of those imported cases came from cruise ships,
Yes.
which we're all well aware of as a risk now. But underneath that, there were concerns early, particularly in March, with this rise in imported cases of community transmission, and there's been many active public health and border measures taken to reduce those risks and to get the disease under control. And we've been aiming for suppression, and I think we've all been really pleasantly delighted to see how effectively that has worked. And over the past week, we've had reported case numbers in the teens every day, nationally.
I mean, look, that's amazing. And speaking to colleagues around the world, some of them are quite envious of what Australia has been able to achieve. And 2 terms are now coming up in discussions. one is the idea of elimination, and the other idea is what you call controlled suppression or controlled adaptation. Help us understand the difference as to these two terms and what they mean.
So I think the difference is what our target is in the disease control measures. So suppression is recognising that this is a difficult infection to control, but it's about reducing the numbers of cases as far as possible while learning to adapt and live with the virus, but to keep that within the scope of our public health system and our clinical services to respond, to ensure that Australians have access to medical care for COVID, but all the other things that they need access to care for. The elimination strategy takes a more proactive goal focused purely on COVID-19 to get those levels down to a very low level. And that means more time, potentially, in lockdown, as we've seen in New Zealand, although they're now easing their restrictions. But that explicit focus is on sort of stamping every last infection out.
And this is last infection within the country. There could still be external introductions that one might get.
Indeed. So we live in a connected world.
Yes.
And we know that there are raging epidemics all around us. We are never going to eradicate this infection. The question is, what do we do and how long do we try to keep ourselves pristine?
Right.
What are our border measures? What are our other measures to stop inevitable reimportation?
Now, I think that's an important term that you used here. So eradication technically means stamping out the virus all over the globe.
Indeed, yeah. As we did with smallpox.
As we did with smallpox.
Yep.
So let's start with eradication. Do you think that's even feasible anymore?
No. I think we're well past, the horse has bolted
That's
there.
it. So we cannot eradicate it across the world. The only hope might be to eliminate it within a jurisdiction.
Indeed.
And then you've got to protect that jurisdiction from the rest of the world.
That's right.
Right.
So
now, New Zealand's trying to do that. What do you think of that?
New Zealand is trying to do that, and I think the challenge with elimination is defining what the end game is.
Right.
So to keep case numbers down to a very low level is clearly desirable. Seeing that as a way of being able to open up social and economic activity would be attractive. But the challenge is then making sure that new cases don't come in, and many who are in favour of elimination, are looking for an effective vaccine, which would be a definitive solution to controlling this virus. The challenge is we've not had a coronavirus vaccine before, and we don't know if we will get one. So all hail to the efforts globally to race towards a vaccine, and there are many, many candidates under development, which is really exciting and important and testament to our adaptation as a species.
Yes.
But if we don't get a vaccine, then what next?
Right, but so there is clearly in both these strategies going to be a period, it could be months, it might even be years, when we'll either have the infection eliminated or quite likely have the infection at a very low level. So life will be able to resume, but it won't go back to normal as we knew it. There'll have to be much more testing and tracing. And I think tracing's been in the news lately, and there's been talk about this app, the CovidSafe. So first, just full disclosure, how many of us actually have the CovidSafe on their phones now? Simon, you have it. Adrienne,
Yes,
that's a yes. I should disclose myself. I do have a Galaxy 10. It's one of the new phones. I have tried to download it twice. It says there is some Android compatibility. So let's call it 3.5. 3.5 out of the four of us have the app on the phone. Now, Simon, you study these apps. Tell us about it. How does the app actually work?
Okay, so what happens is every 2 hours, once you've installed the app, every 2 hours a random code is sent to your phone. And then that code is sent to other phones around you through Bluetooth. So if you're in contact with someone for more than 15 minutes, the phones will connect and your random code will be sent to that other phone. And after 2 hours, the code gets updated again. So it's a new random code. If someone tests positive, then they will have a set of codes that are on their phone, and with their consent, a health professional will be able to download those codes, and that will give them the ability to contact the people that they've come in contact with and advise them to self-isolate.
So, Simon, you raised a very important point, because I was speaking to some other lay people like myself, and they said that your phone connects with the other phone, almost suggesting that the phone's identity is known to the other phone. But what you're saying is that there is a random central code that comes to you, so it's not your identity that's tracked by the other phone, it is that code that is tracked by the other phone. Is that correct?
For the most part, yeah, that's right. So there are a couple of other details, like the make of the phone, things like that are transmitted as well. but it's certainly not just a record of your particular phone or your particular name. Anyway.
So my phone number, it's not as if my phone number is being recorded on the other phone. No. So, okay, so it's a code, and that code is only known centrally by this server. Where is this server?
So it's held by Amazon Web Services, but in Australia. So Amazon has servers all over the world, but you can locate them within the Asia Pacific region. In fact, that server's in Australia. So it actually remains on Australian soil.
So, and who oversees that server?
Well, the technical components will be Amazon,
yes.
But of course the health department is overseeing the specific CovidSafe component.
Okay, and so in the end, through this server, until you test positive, nothing happens. Is that correct?
Well, except that you accumulate these numbers on your phone.
All right, and once you test positive, until you give consent, nothing changes. Is that correct?
That's right. That's right.
And what happens once you do give consent?
So then the numbers that are on your phone will be uploaded to the server, and the contact tracers will be able to use that to contact everybody who you've been in contact with.
Right. So, Jodie, now help us with this contact tracing business. In the real world before apps, contact tracing has been going on. It's been going on, you know, perhaps for 700 years in one way or the other. How was it being done before the apps came around?
It was done by people being detectives. So,
Right.
you know, someone is a case, go back in time, tell me, you know, who's in your household, who else have you seen? We have a definition of a close contact. There's a certain amount of time that you spend with a person. It's 15 minutes in face-to-face contact, 15 cumulative minutes, so you might have seen them for 5 minutes here and 5 minutes there.
Okay.
So that's quite important. And we're really relying on human recall as to who you saw over the last 24 or 48 hours, depending on how far back you go.
And how far back do you usually go?
So we've recently increased that from 24 to 48 hours.
So you only have to worry about 48 hours. You don't have to worry about 2 weeks.
Well, that's about as well as people can do, and that relies on the fact that we think that cases are likely to be infectious for potentially up to 2 days
Right.
before they get disease.
Right.
But we all come in contact, particularly as we move through society more, with familiar strangers. As a transport commuter, there were always people on my train that I recognised every morning. I have no idea who they are.
Right.
And I would have no way of telling anybody else who they were, but I might have exposed them.
Right.
So an app can actually augment the public health effort. People are still going to be talking to public health units,
Yes.
but this can identify other contacts who they might not have been able to name and people they might not have been aware that they have exposed.
So let's say you would go in.
Can I just jump in there,
Please,
Shitich?
yes, do.
So my area of expertise is human memory, and we've been running studies where we look at, we have people collect data and then we ask them later where they were at certain times. And so from those studies, we know that people are incorrect about a third of the time. So that's the kind of level at which the memory deficit is.
Incorrect about a third of a time of where I have been in the last 48 hours?
Not the last 48 hours, that was 2 weeks.
So in the last 2 weeks, I'm incorrect a third of the time. Yeah, that's easy to see how that would be the case. I'm surprised it's as good as that. But look, all of this requires at some level for people to comply. Because for this to work, not only do I need to have it on my phone, the other party needs to have it on their phone. So if I'm holier than thou and the first person in the country who has it, that doesn't really help me at all. Frankly, doesn't help anyone until they also get it on their phone. So the number of people in a community that have it on their phone, of course, matters. What is the acceptance of all of this by the Australian community today? Now, you've been looking at this, so you perhaps some data you could share with us.
Yeah, that's right. So we've run 2 surveys now, and we're gearing up for our third one. And we asked people about different scenarios. So one was an app that looks very much like what the government has released. Another scenario was the government working with telecommunication companies to geolocate people in order to establish contact. And then another one was a very decentralised model based on the Apple-Google approach. And what we've seen is very high levels of acceptance by the Australian population. I'm not sure if we have the graphic there. If we could put that up.
Yeah, we do have the graphic. We'll bring it up right now. And this is where you've not only looked at Australia, you've also looked at the other countries. And so walk us through this. What are the big trends that you see here?
Yeah, so just to explain, the graph is percentage endorsement of different approaches. And we've got 5 countries to date: Taiwan, Australia, the UK, Germany, and the US. And the green bars are related to an app approach, and the purple bars are related to a telco tracking approach. Now, I guess a couple of the headline points, I guess, is Australians were remarkably prepared to allow the government to interact with telecommunication companies to track them through this. So if a opt-out approach was taken, 92% of people said that they would do so in our first survey, or they would endorse that approach. And then that came down to about 87% in our second one. So people are remarkably willing to do that, and much more willing than in other Western countries. So, the numbers are a lot lower in the UK, Germany, and the US.
But Simon, what I was surprised by is that our numbers look a bit closer to those of Taiwan than they do to, say, the US.
Yeah, absolutely.
Help me understand that.
It's a bit of a puzzle to me, to tell you the truth. I think it's a sign of how Australians are feeling, about their government at this particular point in time. The way that this has all been done since the COVID response started, and I think the coordinated response across levels of government has really affected people willing to trust in this particular instance. And so I think that maybe has something to do with it.
But
the other thing that...
Yeah. Go ahead.
So the other thing that we noticed is that, unlike the other countries, in Australia, people saw the telecommunications strategy as likely to be more effective than the app-based strategy. And so I think the threat level has been very high on people's minds.
All right. So, but I think it's one thing responding in surveys and saying, yes, I'll do it. It's quite another thing doing it. And I think an interesting example here would be Singapore, because the app that we're using now is it's been obtained from the Singapore method. We've all thought that Singapore was the poster child of all of this, and it got there first, and it put out the app first. And we have this general stereotype that it's a very compliant society. People listen to government. They don't even throw chewing gum on their road. And yet, in the end, only 17%, or do I have that number right? Well, 1 in 5, less than 1 in 5 people actually downloaded the app. First of all, is that number correct? And how do we explain that discrepancy?
Yeah, so it's about 20%, the last number I heard from Singapore. And the thing that worries me about it too is that the Singapore government did a survey to determine how many people would download the app. And that survey was indicating around 70% would do so. And that's around about the same level that we saw for the Australian population in our first survey. That's now dropped down to about 64% in the second survey. So there could be a very large gap between people's intentions and what behaviours they actually exhibit.
Right. And of course, look, some of that is driven by concern. It's concern about what is this app going to mean? What does it do to my personal freedoms? And how will the government use the data? And our government's tried to assure us. But let me turn to Adrienne. Adrienne, when you look at all of this, this is a new technology inserted into all of this. The Australian community seems to be outwardly very positive. But what concerns you about these things?
Look, I think they've got some reason to be positive, but there are some concerns. When you look at the way this is regulated, and that's my basic position of I've downloaded the app, but I'm going to be keeping a pretty close eye on the way that it's regulated. At present, what we have is a determination issued by the Minister for Health. Now, the content of that determination is very significant. It's really designed to make sure that the app is voluntary, that it can't be made a disadvantage to you, either directly or indirectly in any way not to have it on your phone, and it very tightly circumscribes the way in which the data is used.
So what does it tell us about how the data can be used?
Well, it can only be released to officials who are engaged in the tracing process.
Okay.
Right? And it must be held as prescribed in the server described in Australia otherwise, and only released for a specified purpose.
Now we should contrast this, to put it in perspective, from the way it was used in China. Because in China, as we understand, the health code, I think, or whatever the app was called, became a requirement. You couldn't enter certain zones until you had the app and the app was showing green. Tell us, is that going to be an issue in Australia?
Well, the determination specifically says that you may not require, that a person, not just the government, any person, may not require that the app be present on a phone in order, for example, to enter premises or to participate in an activity. Employers cannot take action under the Fair Work Act on the basis of whether or not an employee has the app on their phone. And so there's quite an extensive way in which the determination seeks to make it really truly voluntary.
Now, Adrienne, you keep using this word determination.
Yeah.
What does that mean?
It's significant, and sorry to be lawyerly, but it is actually significant. So what we have is a regulation that's been issued by the Minister for Health. On the 18th of March, there was the declaration of a human biosecurity emergency in Australia, and that gave the Minister for Health powers to do all kinds of things, including to make this determination. Now, that's fine, but my concern as a lawyer is that these restrictions need ultimately to be legislated. And they need to be legislated for two reasons. As a determination, they can be changed by the Minister for Health. They need actually to be more secure than that. And the parliamentary process will give the nature of the restrictions proper scrutiny through the process of lawmaking. And we haven't had either of those two things. So I'm only comfortable with the determination as a temporary measure, and I hope and expect that this will ultimately be legislated.
Right. Well, so now app is just one of the elements of what has been a huge societal change. You know, we've asked people not to go out, we've put fines on people, and all of that has been done in a hurry. And from your point of view, has it received the right amount of scrutiny in, sometimes these are local state laws, what's your sense about all of that?
So my sense is that, for understandable reasons, we acted fairly quickly and outside of normal processes. And we actually have laws that are designed to allow governments to do that. But it is important, and we're not quite there yet, that we now start to reintroduce the kinds of scrutiny and lawmaking processes that we have. So I am a very big critic of the fact that the Parliament has not sat much during this process. I think...
Why, by the way, has Parliament not sit?
Well, I think that the view has been taken that it would be unsafe for it to do so. But I actually think that we should push back a little bit on that it's possible to sit virtually. I'm confident the Constitution can cope with that.
Yeah, it'd be unsafe for the Parliament to sit, even remotely. Why would that be the case? We're having all our Zoom webinars. There's like 500 of us who can get together and discuss virus modelling. Why can't we get...
So you're absolutely right. There's no lack of safety in a virtual model.
Right.
Of course, that's a very new idea, but I'm confident the Constitution can cope with it.
Yes.
The other way to go is, in fact, how I think the Parliament did sit for just one day in April to pass some of the measures needed to back the economic response, and that is to sit with a sort of proportionate reduction of members.
Oh.
Now, I think that those two methods can be used, and they might even be used in combination, just like we are here today. Some people are here in the studio,
that's right,
and some are on Skype. There are ways to do this. And I think it's important, in fact, that Parliament sit more. Having said that, I think another very positive development, however, was the creation of a special Senate committee, the Senate Committee on COVID-19, to oversee all aspects of the government's response, and that is one on which there are both crossbenchers, opposition, and government has very significant powers. It can sit remotely, it can require ministers to attend and ask them questions, and that's a very important scrutiny mechanism. And we need to make sure that that's done at the federal level and at the state level, in my view.
Now, all of this, of course, presupposes that we're moving towards some kind of recovery, and pretty soon we'll have some resumption of our life back. And very critical to all of this has been the announcement of all of this testing. You know, Victoria announced something like 100,000 tests in the next 2 weeks. And just this morning in some of the newspapers, I saw that Andrew Forrest, also known as Twiggy to people, has found 10 million tests, interestingly enough, coming from China to help us. Jodie, tell us, how much testing do we actually need? We've done about, what, 500,000 tests by now?
I haven't got the latest count.
I think it's somewhere, I think
me.
something like 530,000 or so. Very few positive ones.
So I think, look, first of all, a test is not a test is not a test. There are many different tests that are being talked about here. So there are our diagnostic laboratory PCR tests that are looking for the virus, that are the gold standard for diagnosing an individual with COVID-19 in Australia. These other tests, these point-of-care tests that are coming out on a large scale, might be used to test for virus antigens, might be used to test for antibody responses to the virus, which only come up late, so they're not useful in acutely diagnosing an infection. And there has been a flood of these tests on the market. They're being evaluated in Australia to see whether they are appropriate for use, but they are not a panacea, and they are not a way of making sure we're safe to walk out the door.
Right. So I think the first good point that you're making is that there are two kinds of tests. There are tests that diagnose whether you have the disease, and there's another set of tests that diagnose whether you now have the immunity because you might have had the disease.
Indeed. Yeah.
And the first ones are a bit more standardized at the moment, and the second ones are just coming out. But the second ones are lately all the news because people are giving these so-called immunity tests to lots of people.
Yes.
And the results, at least as far as an outsider could see, are a bit all over the place, because I think there was one from Santa Clara County in California done by Stanford that said that there are 80 times as many people who have immunity than the number of people. What do you think of that?
So every test needs quality assurance evaluation. We talk about the sensitivity and the specificity of a test. So is it sensitive? Will it pick up all the cases that are real? Is it specific? Will it give us false positives and tell us that people might have been infected who weren't?
Right.
So all tests need to be evaluated with those in mind. The issue then of what that immunity means is very uncertain. So we've seen some longitudinal studies of individuals who've had COVID-19. We've seen that they make antibody responses. We then see that those responses start to fall off quite quickly.
Oh, so you could get immunity and it can go away.
So we don't know how robust that immunity will be. There are anecdotal reports of individuals having second infections, and that's clearly very concerning and something that needs to be very carefully evaluated. And we just don't know whether that protection will last over time. So without that, it's not clear, this notion of an immunity passport. I've had the infection, now I'm free to roam about society. That could be a false confidence that could be actually very dangerous.
Right, but you raised this interesting point about specificity and false positives. And help us understand the numbers, because some of these tests say that they're 95% specific or 98% specific. Look, numbers in the 90s look good to me. But people like you are not always impressed by even numbers in the 90s.
Well, let's just say that manufacturers may have an interest in reporting those kinds of numbers, but we might wish to seek independent validation first.
Right.
And obviously, poor sensitivity is a problem if we miss a case, but poor specificity can lead to all sorts of other problems. It can lead to overreactions, it can lead to fear and stigma of an outbreak that hasn't occurred. And for all tests that we do, we have to be equally concerned about those false positives as we are about the false negatives.
That's an important caution. It's interesting that, this business of tests and data and apps is all very new. Just last night, I got a report from someone in India. The government of India, and I actually saw their notice, has actually sent a notice to all of its civil servants, and the government of India has a lot of civil servants, that they must download the app. And they should look at their app every morning, and if they have potentially come in contact with someone, which is determined by the server in the air, they're required not to go to work, but actually go to get themselves tested or go to a health facility. And then in some countries, I think Chile is one of that, is the idea that your immunity passport will be on your app. So we're going to a whole new brave world here, which is mixing testing, data contact tracing strategies. What is the evidence that all of this makes a difference? Simon?
Thanks, Richard. I just wanted to step in there that we've actually been surveying Australians about immunity passports as well, and the support there is significantly lower than it is for the app tracing. So we're seeing about 45% of Australians who are prepared to accept immunity passports at this point.
But what is the evidence? If one got really tough and said, manual contact tracing has been a standard part of managing epidemics. We know how to do it well. We call people on the phone. We keep careful records. And we know how to do it without violating privacy because we've done it. We're throwing at it all these interesting new mechanisms. If one were to be really hard-nosed and say, what is the evidence that this changes the course of an epidemic? And let me start with a counterexample. Singapore was the poster child of all of this. Singapore had the best tracing mechanisms. I'm not saying those went wrong, but I'm just saying that having that has hardly done them any good because their cases were low, they were low, they were low, and suddenly for the last month, that single city, country, has more cases by a factor of 2 than all of Australia. So what is the hard evidence?
So in bringing the app in Australia, as I say, it's augmenting the existing public health tracing capacity, and there's already discussion about evaluating that.
Right.
So we do need, as we roll it out, we need to see how many extra contacts are we finding. Of those contacts, how many are infected? I'm very taken with studies in Iceland that have used whole genome sequencing to actually say of the contacts that we think are linked cases, we can actually look at the genetics of the virus and say, actually they really were linked or they weren't.
Right.
And that's another layer of evidence.
Oh,
and I think there are, we need studies to actually see whether
so
this
just
is
so that I
making a
understand,
difference.
what you're saying is that if one really deeply studied not whether just a person was positive or not, but exactly precise which version of the virus they have, we can start making a tree of who got it and how, right?
Yeah, and in Iceland, the really nice thing that was done, which I think is interesting as we reopen society, was to say, where were these infections acquired? Were they at home? Were they in the workplace? At that stage, it was still about international travel and transport and other places. And that helped to actually separate out really where the risks were in society. Right. And I think that kind of approach is very, very interesting and the sorts of things we need to think about moving forward. Right. But that's the only evidence that we'll have that the app per se augments what we do. I think the Singapore story is a very important one of the way this virus exposes the deep inequalities in our society and really reinforces the importance of protecting the vulnerable, of ensuring equity of access to services and ensuring that the reach of our measures is extended to all of our communities.
Now, you're quite right, because these data technologies are not uniformly spread across society. It could be that it's the sort of well-off protecting the well-off, and the rest, either through access or not feeling comfortable, are not a part of that. And that would be rather sad if we came to that. But Adrienne, from your point of view, this is this rapid, in some sense, unstudied convergence of biological data, IT data, impinging upon the way we run society. Now, I have to say that I personally think that up till now, Australia has come through all of this in flying colours. So it's not critical of where we've been. It's actually looking at where we should be going. What are the safeguards that we need in place?
So there's a range of them. We need Parliament to sit properly according to its regular schedule. We need the committees of the Parliament to continue their important scrutiny work. We need the courts to become involved. They've not been a big part of the story yet. They tend to come later, but we really do need the courts, people to be willing to litigate the limits of this if they feel that their rights have been infringed upon. We need a very active, free media. We need civil society involved. So we need institutions like universities, like we are here today, to be taking a critical look at what's going on. And in fact, we actually need everybody to be engaged in a critical response. So I think Australians have been remarkably cooperative so far, and that's been a good thing. But I want it to be a watchful cooperation rather than a mindless cooperation. I think that's what, as a society, we want all of our governing institutions and our population to be aiming to do.
I think your term's watchful cooperation rather than a mindless one. I think that these will become slogans we should use. Keeping in mind that I think we can all be proud that as a community we've pulled together rather well. you look around countries, and I don't need to name them, you can imagine the ones we are talking about, where despite all the technology, despite all the healthcare expenditure, despite the very best of science, and presumably, despite very similar scientists giving pretty much similar advice, it has come to very different outcomes. And you've also raised the interesting issue of vulnerability. I think Singapore is one example, and perhaps, Jodie, you could tell us a little bit more about what turned out to be the really vulnerable population in Singapore.
Well, obviously the migrant workers living in densely packed housing,
right.
And those conditions where lockdown, social distancing are things we find, tiresome at this particular point in time, but they're luxuries. We can afford to live in spacious accommodation, and clearly many across Australia have been doing it very tough. I feel very fortunate to be a middle-class white woman with a nice house who can keep working through this, and I'm aware that's not been every Australian's experience. But overcrowding and the risk of infection spread among those migrant workers has just meant that when outbreaks occur, they've run rampant.
Right.
So what I wanted to say that I think one thing that human rights lawyers all over the world are looking at, and rightly so, is the position of incarcerated people who are very vulnerable. And in Australia, of course, that includes not only criminal incarceration, but those who are detained for immigration reasons are very vulnerable to the virus, and there needs to be a careful look at them. I also think we need to think not just about the way in which the virus exposes vulnerabilities, but some of our responses will as well. And one thing to be, I think, watchful about is the way in which social distancing measures might be deployed in uneven ways against minority communities, in ways that infringe upon, for example, their freedom of religion or their freedom of speech or their freedom of association. Now, there's inevitably going to be some impacts there, but we need to watch very carefully how those are used.
And in fact, you're raising a good point, because I just read this morning that in the US, some of those communities are actually taking the government to court precisely on the grounds that it's infringing upon their rights that are guaranteed under the Constitution. Now, we haven't had any high-profile cases as yet, have we?
No, we haven't. And I think that's partly because of the difference in our society and the earlier kind of stage we're at in this. But I do want to say that, for example, I don't think that the limits on political protest can continue indefinitely.
Yes.
I think that there are some remarkable ways in which I've seen activists adapt to social distancing. And there was this sort of wonderful vision of a protest in central Tel Aviv with protesters standing in a very regular, distanced pattern. And I think that we have to make sure that political protest, which is a really vital part of our society, is able to go ahead, among other kinds of activities.
But I'd be very interested, how do you police that 1.5 meters? That may take some thinking, but...
These are very difficult,
Yes, it does. Simon, from a data point of view, who are the vulnerable in a society that becomes very tech-obsessed?
Well, those who don't have the tech, I guess.
Right. Is that randomly distributed across society, or are there good socio-economic sort of correlates of that?
Yeah, well, I mean, I think it's everything that you would expect, right? So education level, socioeconomic level, all of those things predict people's access to technology.
And then, of course, geography. I mean, in a country as vast as ours, the distribution of IT is not equitable all across. And I think a very special element that we haven't talked about, and perhaps we should return in some detail, are the specific vulnerabilities of our Aboriginal and Torres Strait Islander Australians. And I think we have a long history of where pandemics and epidemics have affected them adversely. It would be fair to say that this time around, partly because of their early cooperation and involvement, we're doing all right. But I think this is something we'll have to watch out a lot. Now, look, this is something that will change society. And I think, Jodie, you said right in the opening, we're not going back to anything that looked like the old normal. And I'm reminded in many ways of, 9/11. Travel was never the same after 9/11. And now we've just gotten used to it. We just compare relative things. Oh, that airport's a bit faster than this airport. But we just recognize we'll stand in long lines and go through that ritual all the time. So our society will change in many ways. And I can see quite a few ways in which it'll be less palatable, there'll be more restrictions. But I'm hoping that out of this will come some positives. You look back to the Second World War, All the Western societies got their public healthcare systems sometime after the Second World War with NHS and everything. So my question to you is, what good can you see coming out of this? What would be the good, lasting legacy of this COVID experience? Any of you and all of you. Who's going to go first?
Well, for me, I hope it helps us to look a little closer to home in a good way. I think for many people, this has slowed us down a little. It's brought us closer to the people that we live with, for those who do live with others. And it's made us be more purposive and creative about the way we connect with each other. So I think that's been something that hopefully we can take away, is the importance of caring for and looking after each other. And if we recognise this is going to go on for a while, we just have to be more adaptive and creative about the ways we do that and help each other through.
Well, that's wonderful.
Okay.
Adrienne.
Well, two things from a governance perspective. One is that I think there's a big story here around the success of the National Cabinet process,
Yes.
which has been really quite remarkable. And I think it would be worth thinking about what has made that so successful and what could be deployed into the future. Right. The second thing that I have found very reassuring and made me somewhat hopeful for the future in this process is that Australia is still a place where the facts matter, where science is accepted in our political discourse. And we absolutely need to hold on to that, because we've seen what happens when that breaks down in other places, and we're going to need it, quite frankly, for addressing climate change, among other things.
That's another one of those global, larger-than-life issues that no country can solve for itself.
Right.
And I think we've done... I have to say that, after the bushfires, it'd be fair to say we were all a bit despondent as to, first, of course, what happened, secondly, how we were seen as Australia around the world, and thirdly, many of us also wondered what it told us about our governments and how we work together. But it has to be said, what a difference 3 months can make. And one looks back and one can feel positive about all of this. Though I've yet to figure out exactly what good came out of it. But let's hold on to that. Simon, what lasting legacy would you like to see of the COVID experience?
So I guess what gives me hope is the fact that some 2 million people have already downloaded the COVID app. And that's not really enough. It's about 8% of the population, and we need a lot more than that. But I think along with the surveys we've been doing, what's hit me is just the level of support that when the chips get down, the Australian population is willing to give to each other and to their politicians. And simultaneously, we've seen what was a very adaptive and I think responsible approach by our politicians. I think all of that augurs well for our ability to get out of this particular situation, but also I think it's a bit of a health barometer on our democracy.
Well, that's very good. I knew you would find some hope in data and numbers. And I do like that 2 million Australians have downloaded the app. But, I'm reminded when you look at things like Facebook and Twitter, 20 million Australians have downloaded that app. So we'll look forward to where we end on this one. But I fear we have to bring our panel to an end today. And there will be life after COVID. I think we've begun speaking about it. And I hope this gives you some glimpse of some of the challenges we will face as we get there. So please join me in thanking our wonderful experts. And let me thank you for your interest. And if you're interested in this issue, yesterday, Australia's leading universities published a roadmap to recovery, a report for the nation. 100 professors, and of course Jodie was a part of it, from all over the country's leading universities got together to advise on the options for the future and how we should go about it. So the report speaks about one ethical framework. It speaks about 2 options that we have. It speaks about the 3 requirements for success and the 6 imperatives in how we go about doing it. Should you be interested in that, the link will be along with the link for this program. So this has been episode 2 of Life Beyond Coronavirus, the Expert View. The next 4 episodes will continue to explore the impact of COVID-19 on our world, the past, the present, and the future. And as we learn more, we will share this with you. But we're also looking for your suggestions. What things do you think will change life after COVID? Where are you finding hope? What do you think will be the lasting positive legacy of all of this? and we will try to address that with expertise and with evidence. Till next time, thank you for joining us.